What if what you're feeling isn't just burnout? I think that's a big fear for a lot of us. Burnout, there is a chance to recover, but what if this is something more, something deeper? 1 in 8 people have a thyroid condition that is contributing to similar symptoms of burnout. Things like fatigue, weight gain, hair loss, eczema outbreaks, mood swings. Sometimes thyroid conditions are misdiagnosed as anxiety and depression. You can see how that would overlap with burnout and the fact that for some of us, we feel numb, irritable, avoidant, exhausted. So if 1 in 8 people has a thyroid condition, what do we do with that information? Especially knowing that the majority of those people identify as women. Women, 1 in 8 people, have a thyroid condition. They're now saying that this is edging up closer to the frequency of diabetes when it comes to how often this is impacting our community. So what do we do with that information? Well, I'm not a medical doctor, so I want to make that clear. I think it's worth always getting tested. Having your blood tested, have a blood test for TSH, T4, T3. These are kind of the 3 things that people need to look at to know if they have a thyroid condition. Is it autoimmune related? Is it stress related? Is it pregnancy related? These are things that why it impacts women more than men. Why is this on my mind? Well, as a mental health professional, I'm seeing more and more people come into my practice who have anxiety and depression and a thyroid condition. Sometimes it's undiagnosed. Sometimes it adds clarity to their ability to say, oh, I can now know what to do to take care of myself. That's why it's important to have the medical and mental health worlds come together and say, did we eliminate all of the factors? Did we identify everything that could be contributing? So getting tested is one thing I recommend. If 1 in 8 people is experiencing this, what else can they do? Well, it brings us back to our self-care conversation. What are we doing to address elevated stress levels that make this more possible and more painful to experience? How are we addressing anxiety, depression? How are we addressing workaholism, burnout, the things that might bring a thyroid condition and make it express a little bit louder? With this in mind, we need to redefine our boundaries for wellness. Self-care redefined. You've heard me talk in previous videos of it being rest versus restoration. Self-care is no longer about commercialized means of vacations and massages and pedicures. Those aren't always effective, nor are they feasible when it comes to time or money for certain people. Being redefined as rest versus restoration, rest is what makes you actually feel rested. Are you binge watching a show all weekend? Are you hanging out in your PJs? Are you not leaving the house for a day? Versus restorative, what energizes you? What builds you up? What makes you feel happy, joyful even? So knowing those things that restore you is that piece that most people are missing. They think, I got rest, but I still feel like I've been hit by a truck. So we need to have the restoration component as well. So when we have a thyroid condition, of course, you're going to want to work with a medical doctor. You're going to want to get tested for TSH, T3, and T4, and you're going to want to control your self-care. What does that look like to feel restored versus restful? Last but not least, for a lot of us who have a thyroid condition, my clients included, it's about looking at things that are in their control. Is it diet, exercise? Is there anything else they want to adjust or change? For some people, it's a huge diet change. For others, it's supplements. For others, it's exercise, getting out every day, moving every day. This comes to my attention a lot as a burnout consultant and mental health therapist because the overlap is so easy to see. Burnout symptoms of fatigue, numbness, weight gain are very similar to a thyroid condition. It's almost the chicken and egg, which came first. So knowing that that is something I'm actively exploring with my clients, I wanted to share that with you and to empower you to take care of yourselves. It's not just about self-care. It's not just about anxiety and depression. Sometimes there's more to the picture of burnout. So with this in mind, I want you to feel empowered to check this out with your medical providers, with your friends, with your family. You are in control of your health and wellness, and I know that with this overlap and burnout, it's another piece of the puzzle I want you to consider.